Welcome back. This is the kind of second episode of the rotator cuff expert, Dr. Orcutt, an orthopedic surgeon, been around for about 15 years. The topics we talk about I've seen quite a bit in the years that I practiced orthopedic surgeon. One thing, last time we did the first one, and I forgot what the third point was. I don't know if you guys remember. We talked about shoulder pain, what the real treatment or what the real cause of shoulder pain. Most of the time, most people, again, not a substitute for going to see an orthopedic surgeon, but most commonly is rotator cuff. It is sometimes arthritis, and then sometimes it is actually neck. The third one was neck. If you're having pain down your arm, numbness, tingling, it is more likely, even if it's focused on your shoulder, more likely a neck problem than a shoulder problem. But again, go check that out. Check it out with someone else who knows what they're doing. You can do a good physical exam, maybe do some other tests, x-rays your neck, MRI your neck, whatever, to see if your shoulder pain is actually coming from your neck. Again, rotator cuff, probably number one. Arthritis, number two. Neck problem, number three. But then there's a whole host of 50,000 other, well, maybe not 50,000, but hundreds of other diagnoses that can fit in there. That's why you need to go see an orthopedic surgeon if you are having pain. So that's the end of the first episode, although it's been separated into two, so I apologize for that. I was a little bit nervous, my first kind of go around getting my feet wet, so to speak. So we're gonna stop on the first and we're gonna go to the second. The second is frozen shoulder. We also call this adhesive capsulitis. What this is actually stiffness in your shoulder. Stiffness in the shoulder because the joint lining we call the capsule. So what encapsulates or covers the whole joint, unless what keeps that joint fluid in is the capsule. And over time, sometimes people have this thing where that capsule gets thickened, and when it's thickened, it doesn't move very well, and when it doesn't move very well, we get stiff. But when that capsule gets stiff, there's three phases to frozen shoulder. First phase is the freezing phase, so it hurts and it gets stiff. Second phase is the frozen stage. It may not hurt as much, but it doesn't move very well. And the last stage is the thawing stage. So that usually takes between 1 and 3 years. So the problem is people don't want to wait between 1 and 3 years for this to go away. And so sometimes we try to help as orthopedics to expedite or hurry that along so we can get through it. Important to note that if you have frozen shoulder on one side, there is a chance you get frozen shoulder on the other side. Rarely do you get the frozen shoulder on the same side. Again, I have seen it, but that's really rare. Frozen shoulder is pretty rare just in general. The reason why people get frozen shoulder, right? So how would I get this? Well, diabetics seem to be predisposed. Diabetics, people who need insulin, they seem to be more likely to get this. People who have had a stroke because they're not moving the arms can get stiffness. Any other trauma that makes you not move your shoulder. Typically we see people with mastectomies for breast cancer, they don't move their shoulder, they get stiff shoulder. So those are the reasons why you might get it. Or if you just trauma, you break your shoulder. So lots of people break their shoulder, especially older people break their shoulder. And when they break the shoulder, they can't move it because we want the fracture, the broken bone to heal. And by the time we get the broken bone to heal, the shoulder is stiff. And so depending on the reason for the frozen shoulder will determine what we should do with that frozen shoulder. Sometimes nothing, sometimes something. And the some things we'll talk about in a minute. Other things, what we see frozen shoulder most commonly in, besides what happened to the person, but let's just talk about what the person is. Female over 40, most common. Clearly, if I take the amount of patients that I see with frozen shoulder, if it's not a traumatic frozen shoulder, so it just kind of came out of the blue, it's certainly women in their 40s and beyond. There's also some information that if you have thyroid disease, whether hypo or hyperthyroidism, you may have increased incidence of frozen shoulder. And then this lung infection or TB, tuberculosis for whatever reason, and then Parkinson's. If you have Parkinson's, you have increased risk of frozen shoulder as well. How do we know if you have frozen shoulder? So, you have a shoulder pain. Well, shoulder pain, not all shoulder pain is frozen shoulder. Frozen shoulder is something unique. Again, that's stiffness. So when you come to the doctor's office, we talk about how do we determine stiffness versus weakness, right? So there's a concept of passive range of motion and active range of motion. Active range of motion is I say, hey, Sarah, whatever, move your arm, and you go, all right, so that's active range of motion. You did it on your own and it moved. So if I say, Sarah, move your arm, and you go, and you can't do it anymore, Well, that means you can't do active range of motion. And then I get involved and I actually take the arm with my arm or my hand and see how much I can move you. If I can move you up and down, then we have good passive range of motion. If you have good passive range of motion, you don't have frozen shoulder. So passive range of motion is key, a key diagnostic piece to what frozen shoulder is. So if you can't do active and I can't move you up passively when I'm trying to power it, then you have frozen shoulder. There are reasons to have frozen shoulder, right? So sometimes, this gets a little complicated, sometimes you have a rotator cuff tear that you have, and because of that tear, you have moved it, and so you have a traumatic event creating a frozen shoulder. So maybe sometimes you have frozen shoulder plus something else. And that's another piece that we have to work together as the orthopedic surgeon to find out, is there something else creating this frozen shoulder? Because if there's something that's creating the frozen shoulder, then we have to treat the frozen shoulder, but we also have to treat the other thing. So let's say if it was a rotator cuff tear, we have to treat the frozen shoulder by manipulation. We'll talk about that in 1 second. Moving the shoulder, getting it stretched out. And then 2, we have to fix the rotator cuff, because if we don't fix the rotator cuff, we just do the frozen shoulder, you'll probably get another frozen shoulder because we didn't actually fix what the real problem was.